This is the Critical Conversations podcast, a KPOV special project developed to feature unique perspectives and the courage it takes to go there, challenge mundane thought, and question the norm.
Today we're going to talk about one of our most talked about subjects, which is psilocybin. And we have Mandy Miller here today. She's from the Happiness Lab, not the podcast Happiness Lab, but she's a licensed therapist who is training to be a psilocybin facilitator. Hi, Mandy. Welcome.
Hey, thanks, Adam and Shanti, for having me on the radio with you today.
Yeah. Yes. I wanted to chat with you about sort of you're a therapist who's stepping into this whole new realm of therapy. Yeah. And I would just love a little information about what has inspired you to go into psilocybin.
Yeah, thank you. Well, first, before I answer that, I would love to just give a big thank you again to you and to KPOV, to the training program that I'm in, which is Fluence Training. I'd like to thank my family and friends and the people who came before us. This is not a new way of healing or engaging in sacred practice. This has been happening for thousands of years with indigenous folks, and so I want to always give mention to that. What inspired me is I'm a plants over pills kind of person, and I've been working with people with varying levels of severity of mental health impairment for about 20 years, and I've seen what medications that treat certain conditions can do. And psilocybin happens to be a substance and a medicine that has very few adverse effects. In fact, the benefits most certainly outweigh the side effects. So, that's part of what I'm doing here and why I'm interested in being a facilitator with psilocybin-assisted therapy.
Have you had clients that have chosen to do that on their own and notice the positive impact within your practice? Have you seen that?
Absolutely. People who are either microdosing or using it more of a macro dose or on a larger scale of ingestion, and definitely I'm seeing benefits from that.
And you know, there's a lot of talk and research about, you know, psilocybin and the positive incomes and microdosing, macrodosing. There's so much, but on a personal level, what have you noticed? I mean, I guess I'm just asking you directly. Have you also had a chance to see how psilocybin impacts you on a personal level, which has informed your decision also? So you have obviously the research, you know that. Then you've also seen within your own clientele, but then do you also have your own personal experience?
Yeah. The ultimate research.
The best research.
Right. And it's such a great question. And that's part of the discussion in our training and part of the research is what is the efficacy or what is the impact of facilitators sharing or not sharing with clients and patients about our own experience. Since we're not in a service center and this isn't an actual session, I'm happy to share that I have seen benefits firsthand. And I believe that any time a person is moving into a healing modality, this is my opinion, I think it's important to have firsthand experience, especially with psychedelics, partially because of the places you go and can be taken. And without firsthand knowledge, I think that it can only, with firsthand knowledge, I think that can only be helpful in supporting folks.
Yeah, I appreciate what you said because I do agree, like no matter what the technique is, if you have personal experience, you can really relate to the experience of your client on such a different level. Whether it's like you're an EMDR therapist or, you know, you're training an athlete, you know, like you have to really understand what's happening. I believe. I mean, that's maybe not everybody. So within the program, there's a lot of discussion around this. What is the general census in the training that they're talking about with this?
Well, yeah, and I'll just refer to the research again, which has there hasn't, it's what we're noticing is that disclosing or not disclosing, disclosing or not disclosing is there's a question about it, but what we're noticing more and more is that speaking about one's own experience anecdotally rather than talking about firsthand experience. So just like I wouldn't say to you, well, in my marriage, this is what I do.
As a therapist, you don't say that. Yeah.
So, same kind of thing. It's,
I mean, it's such a new frontier, and I'm also just like so curious about even the research. Obviously, we have some past research, like our friend Pri has been part of clinical trials from decades ago. But where is the research coming from for the program itself?
Yeah, so the founders of Fluence Training, Elizabeth is the one that I know the best and has been part of my training. Elizabeth Nielsen, she's a licensed psychologist, and she has been doing trials and supervising trials for about the past 10 years in New York.
Okay.
Through a couple of universities and, Johns Hopkins, and we'll just, There, more can be researched online. All the names and terms aren't coming to me in the moment.
Okay. Yeah, I see.
She's been doing research herself firsthand.
Okay. With a specific type of clientele?
Yeah. I mean, usually there are way more volunteers than there are spots for. The way that people get screened out is primarily folks who have a history or family with severe psychotic disorders, or people who have heart impairment or compromised heart situations, because psilocybin use can increase heart rate. So those are the only two kind of screen out factors, really. Mm-hmm. But the sizes of and the people that are drawn from are adults and ranging from all ages, over 18.
Do you have end-of-life patients as well?
I do not myself at this point, but that is one of the cancer people who are recovering from cancer or are not recovering have been part of clinical trials. Yeah.
Mm-hmm. And what is some of the range of treatments? Is microdosing one of them, or how far do you go with kind of taking that, allowing people to kind of work on some of those treatments themselves, kind of out of the clinic?
Yeah, I think people, I really encourage people to experiment with whatever they want for whatever reasons they want. And part of the great thing about psilocybin becoming more and more in the mainstream and legalized and regulated is around safety. And so people who are doing their own dosing and administration can still access preparation and integration meetings with licensed therapists or other people who have been trained and are trauma informed and things like that. I don't know if that answered the question, but...
No, that's good. Yeah, I think one of the really fascinating things, and you touched on it right at the beginning, is the minimal amount of side effects. I think for me, when I was experimenting with microdosing for mood stability and for just stress management, which it really did help, but the real challenge was finding that sweet spot of every 3 days to 4 days, every 3 to 4 weeks. Like, this is really interesting kind of pattern, and it's so easy to just sometimes get just the subtle, slightest bump almost of something other that you're experiencing, where it's just it's a real fine line in dance. It's a real tricky thing, and I think that's what's so fascinating right now is the deepest research is figuring out people's threshold and what everybody's experiencing, because I think there's so many factors, and that's one of the challenges, especially with many other treatments, with whether ketamine or even THC. I've heard there's mixtures of those. Colorado's working on some of those, but finding that fine line of what's really working for people, because there are many factors, mood to time of the year to the month, whatever. And so I think just exploring that and defining that is very noble. And so it's really important, I think, what you're doing and continuing to help people to understand and discover, because there's a lot of self-discovery through it, wouldn't you say?
That's right. That discovery is one of the hashtags, right?
Mm-hmm.
Discovery, along with openness and curiosity for both the practitioner, the facilitator, and the patient. That's part of what we talk about when we're creating the container. And the setting, the set and setting is such a big contributor to the feelings of safety, the more the softer edges around the outcome of the experience. There we have, of course, everybody knows about the bad trip, which we're calling now challenging experiences.
I like that.
Yes.
That's more true what it is, really.
Yeah, right. The challenge is reaching the limits of tolerance of one's psyche and exploring, where one's limits is part of what draws me to this work. Yeah,
the fascinating thing I've heard is that threshold, because for certain treatments there's a dose that sometimes getting into that can break through, depending if it's psyche things or just self-discovery things. So
it seems like too there's a lot of learning around that, like the dosage part, right? Because everyone has such a different system and can probably metabolize these differently. I mean, I've known people that have done 12 grams. Yeah. And then some who do like 1 or 2, and the thresholds are just like the range so huge, right?
And is it always body mass index? Is it like, what are some of those factors?
Well, at the moment, the OHA they're called the OHA administrative rules, which is the Oregon Health Authority, who's kind of got this 34-page document about what their recommendations are, what the laws are. And what we know so far is in that outline is more around dose and time frame of session. Now, I haven't read every single word of the rules yet, but that is one of the guidelines. And of course, recreationally, people may say, "How much is too much? Give me that much." However, that's not where I would start ever. I always think start small and see what happens. And so there will be discussion, about experience, age, what's happening in the person's life, whether it's a full moon or not, right? The other factors, environmental factors you were talking about. So at the moment, there is no, as far as I know, not a prescribed, this is how much you weigh, this is how much you take. It's more nuanced. How
much longer do you have left of the program?
Well, we just had our midterms for the first part this last week. And so it's 120 hours of training total, which is going to turn out to be about 7 or 8 months. So we started in December with a 4-day in-person trauma-informed harm reduction intensive, and from now until July we have meetings an hour and a half a week on Zoom, and we of course have study and practice in between.
Do you get a practicum?
Yes, practicum is going to be in May, located in Hood River, and depending on how things shake down with service centers, which is the licensed place where psilocybin can be administered.
And can I say, is there only like 1 or 2 counties in Oregon that has approved it, and Deschutes is one of them? Is that right?
The number 7 sticks out in my mind, and I can't remember if 7 counties said no or 7 counties said yes, but yes, it is by county.
And Deschutes County almost said no, right? It was
on the ballot, but we voted yeah.
Yeah, there's some people who are involved with Fluence training, Stephanie Barse being one of those people, who is also on the psilocybin board, and she's been working, as have all the folks who are on the psilocybin board, been working tirelessly to get this possible.
So you will start practicum, and is it just volunteers that come into the clinic that you'll be working with?
Well, at the moment, what the conversation looks like is that it's going to be us.
Oh.
There's 12 of us in each cohort, and there's going to be 2 or 3 cohorts at the practicum. And so it's going to be using probably something like holotropic breath work or something else that can induce similar altered states of consciousness, non-ordinary states of consciousness, to do the practicum work.
And so when you're done with the practicum, what's the next step? What happens for you specifically?
Yeah, I imagine there are going to be a lot of opportunities for connecting with service centers. Again, those are the licensed sites where folks can go and connect with the therapist and a facilitator, and then do the work that way. So I will be connecting with service centers in Bend and Portland, which is the 2 places that I primarily reside, and start supporting folks. Really looking forward to doing that. I'm really excited to get started.
Yeah. I mean, it's really interesting because what I've known, I don't know obviously everybody, but I know quite a few people in the program, and there's such a wide range of backgrounds of people coming into the training. And I would assume with your background, you're going to have quite a bigger scope of awareness of things happening, and it'll be so interesting as a therapist in that role, and sort of what comes up for you and what you learn, and how it informs your practice.
Absolutely. And just to clarify some 2 parts of what you had just mentioned, one is that the Fluence training that I'm in is primarily for people who are already licensed or very trained mental health practitioners. So not every program in Oregon has that criteria. So I'm with nurse practitioners and social workers and psychologists and psychiatrists in my training. And what else was I going to say? Well, so people who are coming through Fluence training have already been working in the mental health field, which I think is a fantastic advantage.
Yeah, it's a paradigm buster.
Yeah, well, I'm curious, where do you see this going? Because this is still very new, obviously on a national stage, but even for Oregon, I mean, we're one of the original, if not the original, the original state, which is groundbreaking and is super cool in itself. But where would you like to see it, or where do you think it's going?
Yeah, I think it's going in great directions. Colorado's next. In fact, this year, Colorado's, if it hasn't already happened, I apologize. I've been pretty, taken with what's happening here. Colorado, California, Vermont, or Connecticut, one of those 2 eastern, northeastern places are unfolding the same kind of thing. And so where I see it going, primarily because of the benefits of the way this work benefits people who have been exposed to extreme trauma. And what we're talking about is veterans and how to serve that population. And so I think that we're going to see, hopefully we're going to see a lot of fantastic outcomes, and then other states will start to join. The work that can be done in one psilocybin session that's 6 to 8 hours long, anecdotally, has been said to be as beneficial as 10 years of therapy. That, of course, is, one of the selling points that people talk about, not always true, but that I think will be seen more and more, and will, get other states to want to jump on board.
Oh, I love that idea. I mean, therapy is needed. It's powerful. And there's also other things that we can start integrating that can really add to the therapeutic healing process. So
it's nice to hear that it's the trauma, which is really still not understood fully. And I think that's such an important thing. And our minds and our brains are still very, very undiscovered, I think, on so many levels. And with psilocybin treatment, I think understanding the trauma and helping PTSD or veterans is a great gateway to diving in and hoping to understand other traumas, because there are many, I'm sure.
That's right. Yeah. And I will just mention also treatment-resistant depression. These are things, trauma history, treatment, depression, these are like national issues, health issues. It's not just something that you hear about sometimes. It's to the point where it's really needing a lot more attention. And so it's dovetailing nicely with the progression of this, what I'm calling the endemic of COVID-19. And people really need ways to feel better. And I think this is one of them.
I love that.
Yeah.
Mandy, so do you have a practice here in Bend? Because you said you go back and forth, and in Portland as well.
Yes, I do. And right now, because of my mobility, all of my sessions are being held virtually online. And I'm licensed in Oregon and California as a marriage and family therapist. And I'm not yet licensed. Nobody is licensed yet as a psilocybin facilitator.
That was a lot of
words, a lot of syllables in a row right there. And so, yes, I see folks as a therapist, as a psychotherapist with a somatic influence in California and Oregon.
Maybe before we sort of get some of your contact information, what about this are you most excited about for you personally and in your field, and what you're really wanting to do and help people with?
Thank you. Great question. Well, again, I think it's mental health. Now I'm going into my second decade in this work, and the saturation, vicarious trauma, burnout, all of that is really real. And so the psilocybin work is exciting because it's going to use a new part of my brain, my system, my spiritual practice. And it's going to be a way to help people who may not want to come to talk therapy, weekly for a year or half a year. And so I think it's an expansion of my own learning, my own professional development, and serving possibly different kinds of folks in the community.
Yeah, that's great. How can we find you? Do you have a website, or do you have a podcast? What are your things?
Yeah, I have an Instagram handle, which is it's The Happiness Lab. That's the name of my private practice. And the website is my name, Mandy Miller, and then my license, which is MFT for Marriage Family Therapist. So it's mandymillermft.com. And I would love to answer questions and help people get connected to resources starting right now.
And then maybe eventually, if we get a center opened here in Bend, maybe you'll be working in Bend a little bit.
That's a hope. Yes.
Oh.
Absolutely.
Yeah, that's awesome. You have anything else,
No,
Adam?
I just wanted to thank you for coming on. I think this is such an important field, and I really appreciate your dedication to helping, of course, and to bringing it to Bend, which is really exciting too.
Great.
Thank you for coming, Mandy.
Thank you, Adam
thank you so
and
much.
Shanti. Appreciate it.
You've been listening to a KPOV Critical Conversation. To hear more engaging interviews on important topics, please visit kpov.org/criticalconversations.